Hi, my name is Levi Sun, Public Information Officer at the San Gabriel Valley Mosquito and Vector Control District. And I will be presenting about the automation of biting back, how to save time and nurture sustainable grassroots community-level interventions. In the next 8 minutes, I'm going to tell you 8 things you can do to save time, money, and maybe your sanity when it comes to fostering community-level intervention, also known as grassroots advocacy. Now, as science and health communicators, you've been educating and engaging with your target audiences for what seems like years now. But does it feel like you're kind of in a rut? In fact, does this sound familiar? Residents are calling you demanding for your agency to spray their yards for invasive Aedes, or calling you saying you're not doing enough to fight the bite against West Nile virus. And then you're off. You're mailing door hangers and brochures. You're running out to do door-to-door awareness campaigns and conducting presentations. You're calling back legislators who are receiving calls from their constituents. Now you're answering voicemails from trustees. You're updating other departments. You're updating the front desk. Heck, Windows wants an update too. So let's talk about the 8 ways we can trim the excess stress out of that workflow, especially when working with the more active residents of your agency. Step 1, determine the goal of community-level intervention. At the San Gabriel Valley Mosquito and Vector Control District, we realized that we needed to improve relationships with residents who want to be more involved with mosquito control. That is why we launched the Bite Back program. The objectives of the Bite Back program are to support the agency's mission and have a positive impact on local, regional, and maybe even nationwide legislation. Step 2, determine staffing. We decided that having 2 outreach assistants and having 1 public information officer who oversees the Bite Back program was enough to sustain and grow with the program. Now, we will obviously draw in extra help from other communication staff or other people from other departments, such as operations. Step 3, determine the details of your intake and onboarding process for your community-level intervention program participants. For our Bite Back program, we calculated that it took at least 15 minutes total to intake, onboard, and convert someone to the next step. When you add it all up, that's a lot of time. We also had to determine our target audience. We then focused on residents who had the disposable, dedicated time to work on activities with us. These also tend to be residents who are most active in their community. We decided to offer up 3 different activities for our Bite Back champions. The first one is to just receive email updates. The second one is to help distribute door hangers or brochures in your community. And the third one is to be a Bite Back captain. This is someone who will rally their neighbors together and conduct a neighborhood level event with Vector Control. We decided to use MailChimp, Acuity Scheduler, and Monday.com to help us with the automation of intaking and onboarding our Bite Back champion participants. Step 4, determine how you want to manage the participants of your community-level intervention program. For our Bite Back program, we realized that we need to make sure we hold our champions accountable for what they sign up for. In addition to that, we also had to determine exactly what kind of data we want to get from them. So we were able to decide that we want their address, their emails, and contact information so that we can better service their request. The automation tools that we ended up using was Monday.com and Zapier. Step 5, determine the cost of implementing automation tools to support your community-level intervention program. For our Bite Back program, we realized that we needed to have at least a seasonal position to help us ramp up and maintain the program for a portion of the year. Now, comparing the cost of a seasonal position to the cost of automation tools such as Monday.com, Zapier, MailChimp, and Acuity, we realized there was a clear winner here. By using automation tools instead of hiring for a seasonal position, we were able to reduce the cost of supporting our program by 94%. In other words, we saved nearly $19,000 a year by using the automation tools. Step 6. Plan your implementation and determine how it may be perceived by your participants. Now, our program is nowhere near perfect. We made a lot of mistakes getting to where we are today. But I do have one critical advice, and that is test your programs, test it again, and make sure you test it at least on a monthly schedule. Now, for our rollout of our program, we positioned it as a pilot to our champions. So that way, they're much more forgiving if they accidentally receive a double email or receive something in error from us. This will improve your retention rate as your program grows. Step 7, plan your content. People who know me know that I say this all the time. Content is king, but distribution of that content creates the kingdom. Make sure you have enough content in video, on your website, and also in email form to frequently engage with your participants. The goal here is to increase retention rate and decrease the drop-off rate of your participants over time. Step 8, share your knowledge and experience of any automation tools that you will use or have used in supporting your community level intervention. Now, this seems kind of weird for a step to help save you time and stress, but if you think about it, our industry is built on the successes and failures of our peers and professionals. And that is why I encourage you to go to sgvmosquito.org/MVCAC to learn more about my presentation. Now, in less than 8 minutes, you have learned how the San Gabriel Valley Mosquito and Vector Control District has automated its grassroots approach to building local advocacy and support. Our automation tools save 15 minutes to intake and onboard each participant. The same tools also helped us reduce the cost of supporting the Bite Back program by 94%. We also had the unintended benefit of having the automation run and onboard people without the need for staff to be present. This is key if our agency ever faces a closure due to COVID-19. At the end of the day, we are really here to motivate people to become public health agents of change and to bite back against mosquitoes. And for health and science communicators, it just means using technology to work smarter, not harder.